The Democratic Republic of Congo continues to carry out its national vaccination campaign against Mpox. The country remains the global epicenter of the virus, recording more than 30,000 suspected cases and near 1,000 deaths since the start of the year. The rollout that started over the weekend comes as a particularly virulent new strain known as Clade 1b is spreading exponentially. DRC received 265,000 vaccines, and health authorities said a mass campaign won't be possible. Let's bring in Dr. Fiona Banks from the WHO. Welcome, Dr. Banks. So first, do we know how is the vaccination doing in the DRC?
Thank you. The vaccination campaign did kick off in the DRC over the weekend, starting in North Kivu province, and the approach is using a targeted vaccination strategy where we are starting off with high-risk groups, the frontline responders, health workers, and contacts of cases that have been confirmed, as well as high-risk groups that are commercial sex workers and groups like men who sleep with men or casual sexual partners. And so the idea is that this phase would stop the outbreak in the hotspot areas in a combined approach, including intensified surveillance and engagement of communities and other community protection measures. So far, the campaign has kicked off well. There are some challenges around ensuring we identify all the contacts of the cases, and in situations where diagnostic capacities are a challenge, that also limits the process in terms of identifying contacts. But otherwise, it has started, and it has also started yesterday in South Kivu.
We're getting 265,000 doses. North Kivu only, there's 8 million people living in North Kivu. Are you confident that this disease can be controlled?
So the first phase, it's being done in a phased approach, especially due to the available vaccine that we have. In those populations that are very high risk, if done very well, using evidence and the data we have to target the vaccination in the hotspot areas, in combination with the other strategies, we can stop the transmission in the hotspot areas. Then the next phase would be to expand to other high-risk groups, the IDPs, that is internally displaced people, and the refugees that we know are also at very high risk. That will require an additional 2 million doses, and then they can be a wider vaccination for the bigger population. So we will need more vaccine, and we are hopeful now that the pre-qualification has been done for one of the products, and a second is in the pipeline, that more vaccine will become available in by the end of the year and in 2025, and we should be able to have more populations protected. However, I also want to mention that this disease has been with us for decades, and there have been outbreaks before that have been controlled through the other approaches, the public health and social measures, the intensified surveillance. And so we still need to, in the limited scope of vaccines being unavailable, we still need to remember and encourage countries to implement intensively those other measures as we look towards getting more and more vaccine available.